So welcome to Beyond Limits. This is, I just wanted to do a little video. My name is Dr. Legree and this is Bunny. And we wanted to just give you a feel for what goes on in the office. There's so many amazing testimonies if you just go on our Facebook, first of all, at Beyond Limits Health Intervention with neuropathy testimonies, so you can get a feel for the work that we're doing here with the different types of neuropathy. There's inflammational causation neuropathy, there's chemo-induced neuropathy, there's neuropathy, there's diabetic neuropathy. But I really want you guys, I know there's a lot of options out there. There isn't a person who comes in, who, if they're actually serious about fixing their neuropathy, they can have great success with what we're doing in the office here. Just to give you an example, Bunny has a Beyond Limits, is on our team now, but Bunny was a patient on 4/23, and you came in super severe, and you were disabled. And from the outside point of view, like, what are some of the things you could say to these guys so they could feel comfortable? Because you didn't know Juanita or I or this office. We're just another chiropractor. Possibly in your mind, but like, what was your experience when you came as a patient a little over 90 days ago?
When I first walked through the doors here at Beyond Limits, I can say I was greeted with a smile. I wasn't treated just like a individual off the street coming in with a problem. When I came in, I was greeted by Juanita with a smile, asking me questions, telling me it was going to be okay. And then once I got to the doctor, Dr. Legree, he assured me that he could help me. I just needed to be upfront with him. And I was able to talk to this doctor without him finishing my sentences, without him telling me what was wrong with me. He listened at me, versus to where I was going to regular doctors, and you go in, you may sit an hour or so, 30 minutes, whatever, and you only see the doctor for 8 minutes. Dr. Legree takes his time and he listens to you. Basically, he heard my cry. I was crying for help when I came through those doors. I was a sick individual. Feet hurting, couldn't walk, hands tingling. I didn't know any other options. I had done everything I thought I could do. And when I met Dr. Legree, it was just a change right there.
So, like, what were some of the characteristics that you were going through, like, at home before you met Juanita and I?
Okay, I previously wasn't able to get up to use the bathroom. I had to help, my husband and daughter had to help put me on the toilet, position me somewhere so I could be stationed till they came back home from lunch or whatever, to help me get something to eat or go to the bathroom again. And it was an awful feeling. It was awful not being able to help myself. And I felt like I'm only 47 years old. I mean, I'm not old. I'm still young, and I didn't think that was a normal act of life. But people be telling me that that's normal, you can do like that. It's not normal. I was in fear, and I was scared to step out. But I realized I had to do something to take a change in my life.
Yeah. So I think half your guys' battle, because it's real easy to make positive changes if you want to do the work that's required with the program. We have a program that works if you have patience. If you think injections and more Lyrica and gabapentin and opioids are going to heal a 3-foot nerve from your hip down to your toes, I hope this pops your bubble and helps to educate you. Neuropathy has been generating for years in an internal bodily state that is an inflammatory state. The destruction to the covering of the nerves, which affect the function and the blood supply and the oxygen supply and the nutrient supply, did not happen overnight. And it takes, I get several different patients weekly from other neuropathy approaches. Now, they come in and tell me what is being done in other areas. There's no injection that's going to be a quick fix, take all your pain away. There's no there's no cortisone shots, there's no steroid injections, there's no one injection that's going to heal neuropathy. Neuropathy is a 3-foot nerve issue. There's several components to the rehabilitation to the nerve. So we make it completely no risk to come in and check out our program and see. But I want you to go on the website, or not just the website. I want you to go on the Facebook page, and I want you to see people like Bunny. I want you to hear what their testimonies are. I want you to see their story. And so you have proof. So you don't just believe us. It's easy for us to help you if you understand neuropathy. So we do extensive education, and we have an extensive process that produces tremendous results. Go on the Facebook page at Beyond Limits Health Intervention now and look at the neuropathy testimonies. Scroll through. Go on our YouTube page. Look at the neuropathy section in our YouTube page. You'll understand that you don't have to have fear, other than the fact that you definitely better have a reverent respect, because neuropathy is a progressive condition. It is not going to stop. You may be having some good days, some up days, some down days, but eventually it will lead to disability. It'll lead to canes. It'll lead to walkers. It leads to no life, falls, broken hips, broken wrists. We have MDs that come into the clinic for treatment because the gabapentin and Neuron and the injections, the steroid injections, all the opioids don't do anything but cover up the pain signal or the irritation from the nerve irritation. When you're trying to heal a nerve, if you cover up the pain, if you shut down the nerve signal or the numbness and tingling, if you shut down the pins and needles effect, I promise you that iceberg will get so gigantic that it will come and it will put you on a full-blown disability. It will not allow you to go to the stores, to the shopping centers. It will even take away, just like it did one of our MD patients. He lost all feeling in the bottom of his foot. He ended up crashing his automobile, surrendering his license because he was no longer going to be able to feel the brake pedal and the gas pedal safely. So I highly encourage you to come in, sit down, come in for a free seminar and get educated on what neuropathy is and how to rehabilitate it naturally without side effects, because insurance and medications have no solution for neuropathy, and maybe you have to go down that path and find out the truth in that. But we want you to know that we're here for you with a fantastic program. You're like what, 90 days?
90 days in.
90 days, and goodness gracious, you came on board as a patient, and what have you seen with some of the patients, the new patients, even in the past 90 days? I know we're going to wrap this up because what have you seen with some of the people in their journey and their heroic struggle?
I see a lot of change. They're being consistent with what you're prescribing to them to do, and I'm seeing color come back in the faces. I'm seeing people get up out of chairs where they were having to use canes and walkers to push up and get out. I actually watched a patient yesterday dance here in the office that could barely even get up out of a chair, and it just shocked me. I had to give him a hug yesterday because I was just so excited because I was excited for him, and I root for everybody when they come in. Because you just have to be consistent with it. If you're consistent with it, then it's gonna work. But you have to know you got to put forth the effort. The doctor can tell you what you need to do. You have to do what needs to be done if you want to regain the feelings back in the hands and the feet. Because it's like you said, it's not going to get any better. It's only going to get worse. And when it gets worse, then there's nothing to do anymore. And once your life is just gone after that. Like I said, I'm enjoying my life. I have feelings in my hands, my feet. I mean, I'm just excited. And then, like I said, I put forth the effort. So, like I said, I'm just excited.
So give Juanita a call at Beyond Limits. The phone number will be right under this link. And don't hesitate to do your due diligence in your research, because we may be able to answer your prayer and help you to recover your life. So thanks for listening. We hope to see you guys soon.